We treat really sick people on a regular basis. So of course it used to be that the hospital had very critically ill patients, and then when it was time for rehab, they would come to post-acute and long-term care. We're now basically treating what used to be considered a hospitalized condition in post-acute and long-term care. So we have individuals who are on IV antibiotics and who have very severe wound care needs and who have chronic illness also.
The types of patients that I treat are really varied. I work in a continuing care retirement community, so I get to take care of a lot of people who've actually taken very good care of themselves. You know, they've exercised and they've eaten right and they've done a lot of good things. And so I get to take care of a lot of very elderly people, people who live into their 90s and 100s. And it's a privilege. It's a privilege to care for these individuals who've lived long and productive lives in a variety of ways.
I've had some younger residents lately. I've got a paraplegic patient who has some significant skin breakdown, and we're working on getting his wound healed.
One of the facilities I've been in has many individuals with chronic illness that has rendered them unable to care for themselves, so multiple sclerosis and spinal cord injury and Huntington's disease and other neurologic conditions. So it spans a lot of different subspecialties. So you're seeing cardiac disease and neurologic disease and cancer and all sorts of things, which is what makes it so fun.
I do love the fact that we have such a variety of patients, right? I mean, most of them are elderly, but not all. Most of them are really sick, but again, not all. So we take care of people who are coming in and getting better and going home, and that's great. And we're also taking care of people who are there for the long haul.
I care for older adults who have cognitive impairment of various types and levels. I care for people with chronic diseases. I care for people with a lot of frailty that they're managing, and I try to help them to manage it as well as possible. I interact with a lot of individuals, especially in the skilled nursing facility.
Physical therapists, occupational therapists, speech therapists, dietitians, massage therapists, music therapists, nursing home administrators, directors of nursing, certified nursing assistants. And then, of course, a lot of our work has to do with transition from hospital to nursing home. So hospitalists, cardiologists, neurologists, when you're trying to figure out why this medication was prescribed in the hospital and can I deprescribe it, we'll call the specialist who added that medication. So I end up interacting with a lot of the subspecialists as well.
But the people who choose to work in nursing homes are just great people, right? I mean, right from the nursing aides all the way through everybody else, housekeeping. It's people who choose to work with the most vulnerable population, and it's a labor of love. It's like a calling for a lot of the people who work there. And
I also enjoy working with my administrator, the director of nursing, the therapists. The therapists are wonderful individuals in the nursing home.
But they choose to work there, and it's because they know they're helping. You know, they get up in the morning, they look in the mirror, and you know, they don't have to ask that question, am I going to be doing something today that is of service to others? Because every day that answer is going to be yes, and you know, God bless them for and I hope if and when I ever need that there's still enough of them to go around.
It's great to work with dietitians and social workers who really help to make those transitions of care the best that they can be, and also to work with nurses of a variety of levels, a lot of our licensed practical nurses who are there every day, know their patients so well, and then also to work with certified nursing assistants. They're the backbone of the nursing home, and they make an individual's day. You know, they really have such a profound impact on the residents of the community, and whether they have a good experience or a not so good experience, or whether they have a good day or a great day.
I think many of us who went to geriatrics didn't want to be funneled into a subspecialty where we had one organ we were dealing with all the time, and that's absolutely the case. We get to see everything all the time, and it makes it fun and exciting and complicated and hard to do. So what I teach to the fellows and to the fellow futures and to the fellows in our institution is, if you like internal medicine, you will love geriatrics and you will be enthralled with post-acute and long-term care.